HPV is a virus that can affect all parts of the body that have skin layers. The HPV that we're concerned with, being gynecologists, is the HPV that can affect the cervix. And HPV is the virus that can cause precancer changes in the cervix as well as cancer. Now, cervical cancer is very rare in this country because we usually diagnose it as precancer, and after treating it, then we don't never develop cancer. So once HPV was found to be the cause of cervical cancer, we now can test for it on the pap smear, the same way we test if your cervical cells are normal. We can test for the virus at the same time. Most students, most women 20 to 30 who are having sexual activity have been exposed to HPV, unfortunately, because most men do not know whether they have it or not. So women, it's very important for them to go in and have a pap smear. And on your pap smear, you can be tested for HPV, but you don't necessarily need to, because if your pap smear is normal and you have HPV, we still just follow you once a year, with your normal pap smear. If your pap smear becomes abnormal and you have HPV, then we need to take a closer look at your cervical cells, because the pap smear is just a screening test. And to do that is a procedure called colposcopy. It's done by a gynecologist. It's done in the office. It takes only a 15-minute visit to have a colposcopy. It's usually discussed with the patient first exactly what's going to happen. And we look at the cervix with a vinegar and with a special microscope and look for abnormal areas. And if we identify abnormal areas, we do a biopsy, which is a very small sampling of tissue. So any woman who's had a pap smear knows that we put in a speculum to see the cervix, and these instruments that I'm going to show you are very long because they have to go through the speculum and reach the cervix. So when I do a colposcopy, the first thing I do is look at the cervix with the vinegar, and then to look inside the canal of the cervix, which is very narrow, I use this kind of like tweezer-like thing at the end here, where I put that into the cervix and gently open the cervix a little bit. I don't know if this is showing on the camera. Open the cervix very mildly, just a few millimeters really, to see into the cervical canal, okay? Doesn't hurt or anything, okay? Okay, then to take a biopsy up in the cervix, we have a sharp skinny curette, and we take a little scraping in the cervix, not in the uterus. And this just gets a little tiny bit of tissue, almost like the pap smear does. And then if there are abnormal areas on the surface of the cervix, we use this. It does have a little sharp edge. And we take a little tiny snip of tissue, very small, almost like the clicker on a pen. And this causes a little bit of cramps, as do the other. The cervix doesn't have the same nerve fibers as your finger, so it doesn't feel the pain. It does feel mostly cramping. Most of our patients will take a little Motrin before they come, or we'll give it to them afterwards. That's usually enough pain relief. Being gynecologists, we're mostly concerned with women's health. Obviously, in a sexual relationship, there's two partners. Women in same-sex relationships have a very low incidence of HPV unless they've gotten it from a prior male partner, but it's possible to have HPV. But women in heterosexual relationships, we do recommend condoms because condoms really can protect against the spread of HPV. So we recommend condoms for all patients that have new partners or are unsure whether their partners are monogamous. And then if you develop HPV and you are no longer using condoms but you're with the same partner, we don't necessarily think you need to start using condoms at that point, but if you had a new partner, then definitely condoms would be important for protection against HPV and also all the other sexually transmitted diseases that you can be exposed to, like chlamydia, gonorrhea, HIV, things like that. Well, it's actually the first vaccine that really prevents against developing cancer. And so the vaccine is developed by a company named Merck, and it was FDA approved. This June will be 2 years, and they call it a quadrivalent vaccine because it's preventive against 4 strains of the high-risk HPV. So, I'm sorry, 4 strains of HPV. 2 are high risk, 2 are low risk. The reason the low risk strains were included is because they cause a lot of the abnormal pap smears that are more annoying. Maybe you come in and have this procedure I just discussed, but there's no real precancer changes. So that's why the 2 low risk were included as well. So it's type 6 and 11, which are the low risk, and type 16 and 18, which are the most common high risk in this country. The vaccine was tested on 20,000 women, now followed for over 6 years, and they found that no woman had all 4 strains. So even if you've had an abnormal pap smear in the past or had been told you had HPV, we still recommend you get vaccinated. The vaccine is very effective, meaning if you get the full course of 3 shots, there's over a 95% antibody response. It supposedly will cut down by 70% on cervical precancer changes. The vaccine is very, what's the right word? The vaccine is very safe. There's very few complications associated with it. It can be given at the same time as any other vaccine. There's a timeline for 3 injections. You would get it and then 2 months later get another injection, and then 4 to 6 months later get the last injection. It's made through recombinant DNA techniques, so they take the DNA out of the virus and grow it in a dish and make the vaccine from that, so that you cannot get infected from this vaccine. And the vaccine is recommended for girls 9 to 26 years old. Now the company that makes it, Merck, tells us that they are applying to the FDA to extend the timeline after 26, and they're also considering they would like it to be marketed to boys as well as girls, because the boys are part of the vector for HPV, even though they don't necessarily get they don't have a cervix, they don't actually get any precancer problems from HPV, but that has not yet been approved by the FDA. Well, it's my experience that most college students have insurance, so it is covered by insurance in Massachusetts for most insurance companies, so you should first check with your insurance company. And then I believe the vaccine is offered on various college campuses, otherwise through your gynecologist, otherwise through your primary care. And anybody who has questions or would like to obtain the vaccine can, contact their insurance company and their provider.